Yeah, that's a very big topic. And I think what we are learning is that in the old days, particularly when the focus was predominantly on autologous transplant just with high-dose chemotherapy, that was much of more of a distinction, where are you fit and young and can you tolerate heavy chemotherapy compared to are you older, and that's going to be really hard. I think where it's changing is we're using chemotherapy, but now in the context of treatments like CAR T-cell therapy, and that sort of distinction is moving older and older all the time. All told though, in patients for whom either a transplant is not possible, or they have had the transplant and failed, or it's really just haven't proven enough sensitivity to chemotherapy to proceed, there are actually a lot of new drugs that are being used in that space. And that's everything from antibody drug conjugates, which look very good, novel targeted therapies, which look good, and as I say, now cellular therapies, which also look good. So I think this time, if a patient does need a transplant or is not able to get to a transplant, there are many options that remain.